Dr. John Jerome has been a friend of mine for the better part of 30 years. Recently I had a chance to sit down with him and talk about his perspectives on the beginnings of the field of psychophysiology. Let's begin by letting John introduce himself and talk a little bit about how he was first introduced to the field of psychophysiology.
Okay, I'm John Jerome. I have a Ph.D. in counseling psychology. My minor was in physiology, and I started out here at Michigan State in 1965, bachelor's degree, went on to a master's in rehab counseling, and at that time I ran into a fellow named Tom Adams, who was the professor in physiology department, and I was in the psychology department, and I was torn between don't want to be in physiology or psychology, and a lot of interesting research going on. And at the same time, some orthopedic surgeons in this town went to a workshop and they heard about psychological testing and some early biofeedback, and they thought it might help chronic pain patients. So they were looking around for a psychologist, and I was working at the hospital as a master's degree psychologist, and I was hanging around with the physical therapist, so I found myself always sort of moving toward the physical part, but always had interest in the psychological part. The physical therapist basically said, there's some orthopods who are looking for a psychologist to do psychological testing. And so I met with them and I said, I'll do the testing if you let me do the biofeedback. And they wanted to know why. And I said, because in terms of pain, the mind and body are pretty intertwined. And that there's probably a pain signal, a physical sensory component, but there's an emotional affective response. And I was really interested in that. So I sort of found myself one foot on the dock, one foot on the boat, physiology, psychology, and it was before there was psychophysiology. And so I worked with my chairman. I was in the Ph.D. program in psychology, and we set up a special set of courses so I could minor in physiology. And we started a pain clinic here in Michigan in 1974. It was probably the first pain clinic in Michigan, fourth or fifth in the country. We visited a fellow named Norm Sheely, who is a neurosurgeon, went on and got a Ph.D. in psychology, and he was all excited about doing facet injections. And facet injection is basically blocking the innervation of the facet joint, lidocaine, marcaine, and he was getting excellent relief. And so our orthopedic surgeons and I visited him, and he was doing biofeedback, and he was talking to the group, and he was talking through diaphragmatic breathing and relaxation training, and then he was talking about nutrition, he was talking about stress and lifestyle and high-risk behaviors. So now we have a neurosurgeon talking like a psychologist, we have orthopedic surgeons wanting to do nerve blocks, and we have a psychology PhD student wanting to do biofeedback. And so all those pieces kept coming together. And
my next question to Dr. Jerome was, why should a student in mind-body medicine study the field of psychophysiology?
Well, I can't imagine anything that wouldn't be more interesting. It's always the interaction of psychological and physical variables. I mean, you can read in biochemistry, you can read in brain anatomy, you can read in philosophy, you can read in psychology, and you can see the threads of treatment effects cutting across different domains. And I just feel that there's nothing more interesting than working across psychological and physical problems together. As a psychologist in a pretty conservative medical environment, very simple ideas go a long ways. And then at the same time, I'm learning continuously from the physicians and specialists who are really hungry to educate us on the chemistry and the anatomy and the biology, and they're eager to learn the psychology and the psychosocial components. So it creates a really wonderful marriage where there's a lot of mutual respect, and the end product is patients get really good treatment. They feel that they're heard, that you believe them, that there's a physical reason, there's an emotional component, and that if you treat both concurrently, you're going to get a good treatment result. You know, the issue in my field was chronic pain was I'm not going to go see somebody like a psychologist because that means the pain's in my head. You know, and the first thing that you debunk within a minute or two is that I believe you, the pain's real, there's a biological explanation, and by studying psychophysiology and boning up on this physiology part, I can explain the physical anatomy and the biology. So I say there's a pain generator, there's a nociceptive signal, that signal's persisted for a period of time, and that's changed and altered the neuroanatomy, and that our nervous system is plastic and dynamic, and with persistent pain and dysregulation, other problems start to occur. Chronic sleep problems, excessive muscle tension, anxiety, irritability, and then all the psychosocial stuff, loss of income, loss of vitality, impact on family. So you can start out with anatomy, and you can get all the way to the whole social psychological all in one session. I can't find anything that would be more interesting and rewarding than to be able to move comfortably from biology to psychology, back to biology, and provide that information to a patient. I learned a long time ago that the more they learn, the better they'll do. That they appreciate someone who understands basic science, understands anatomy and physiology, and can easily go into the whole psychology, the whole cognitive behavioral part. So you bring a lot to the table if you're comfortable with psychophysiology.
I also asked John why he thought a student in mind-body medicine should study the area of biofeedback.
I think it's really important because it anchors you in physiology. You want to learn basic physical anatomy and science, and you'll learn it if you're doing biofeedback. Also convinces the patient that there is, very immediate changes in physical status based on what you're thinking or what you're feeling. Sometimes I'm hooking someone up on EMG biofeedback, and they'll say, well, I didn't do too well in the relaxation part, so why don't you just instead think about something's going on in your life for about 5 minutes and just kind of watch the needles or listen to the noise. And then we'll talk, and 3 minutes later I'll come walking in and they'll take the headphones off and they'll go, my goodness, I don't know how to relax, but I sure know what my problems are. Say, I'm thinking about this, or whenever I had this feeling. So all of a sudden, tons of information. They realize their mind and body are helplessly intertwined. They know that certain thoughts cause arousal. Then you can start teaching basic science about, dysregulation of the autonomic nervous system and the endocrine system. A model that we have that is just published in the Foundations of Osteopathic Medicine 2011 talks about, put together a model for the Foundations of Osteopathic Medicine textbook that all osteopathic students will learn when they think about mind-body medicine. And it talks about the musculoskeletal system, the immune system, the neurologic, and the endocrine system, and how they communicate with each other, and how difficulties in one or dysregulation in one creates dysregulation in the other. So you can have a musculoskeletal problem that you can learn about and practice and train in a healthy way with biofeedback, and know downstream that's going to affect your immune system. It's going to affect your endocrine system and your neurologic system. So you know that all these systems function as one super system. And so at a basic science level, physicians are learning that the whole body functions as a dynamic system. And biofeedback is the linkage, and if you're the person who knows it and can explain it to the patient in everyday language, they'll be very appreciative and they'll follow the advice. Doctor says don't smoke, lose weight, get a life, stop doing high-risk behaviors. You come in and talk about basically how the mind and body operate, and when you dysregulate one section, how it dysregulates the other. And so I can't think of a more central spot in healthcare than to be doing mind-body medicine or psychophysiology, biopsychosocial medicine, whatever you want to call it.
Finally, I asked Dr. Jerome if he could share a favorite story regarding his work in the field of psychophysiology.
Threw me back to an old story when I was in graduate school, and I was more on the physiology side, and I was measuring, and they had a study going where they were looking at mothers who had children who were having failure to thrive, that the babies were not gaining weight and so on. And we made a container that had measurements, motion detectors in it basically, had all wrapped up like it was a baby, and we had the mom have it in her lap while we interviewed them. And then we just told him to hold the baby, hold it like a baby. And then I was in the next room measuring, and I was watching these seismographs and these primitive motion detectors on a old grass chart recorder that's going like this. And I couldn't believe, I thought there was a mistake or there was some error or the wires were loose. I couldn't believe the amount of motion that was going on. And I was just struck that that baby is being jarred and wiggled. It's almost like shaken baby syndrome, and that mother had absolutely no idea at all how tense she was and how her body was when she was holding the baby. And that data for the pediatricians was so important to them. They realized right away that the mom was stressed, and that's why the baby was failing to thrive. And to me, it really drove home how important your biology is to not only you, but the ones around you, particularly mother-child. And, after that, I was just hooked on biofeedback. So that was it for me.
Well, thanks for sharing that, and thanks for taking some time with me today.
Thank you.
Just remember, it's Don Moss and Fred Schaefer who put the psycho in psychophysiology.